Everybody, it is Dr. Kachikian from the Black Hills Regional Eye Institute, and I've done epithelial basement membrane dystrophy videos before. I think there's at least one on the channel, but it's always good to see it again because sometimes it's a little hard to believe how this works. Epithelial basement membrane dystrophy, or anterior basement membrane dystrophy, is a condition where the corneal epithelium does not anchor down the way it should. And what you're going to see here is just how poorly anchored this patient's epithelium is. The epithelium should be difficult to remove, but here it just wipes away. Just watch. You'll see with one swipe of the wax cell, all the surface epithelium just wipes away from the cornea. It is that poorly anchored down. And as you saw at the beginning of the video, this patient had a contact lens in and probably had a contact lens in for the last month or so. And so this epithelium is not going to anchor itself down without some intervention. So the treatment here is to wipe away all of the loose epithelium that you can find. Sometimes some physicians will try spot treatment, and I don't think that works very well. You have to identify all the loose areas, wipe them away, and then my preferred method is to use just a diamond burr on the surface of the cornea to, one, remove any basement membrane that's adherent, okay, because there's going to be some basement membrane left over after you've wiped away that epi, and that is not helpful to allowing the regrowth of the epi to anchor itself back down. You can kind of think of this as similar to sanding a surface before you paint it. That's what we're doing. We are using this diamond burr, you can call it like a Dremel tool, to prime the surface of the cornea so that when the epithelium grows back, it anchors itself down a little bit better. So now all the epi is removed, the surface has been kind of freshened and primed, the epithelium can grow back and it can anchor itself down better. There may be a small component of scarring that allows it to anchor down better, but it does not affect the vision. And for the most part, if a patient has had this done in the past, you really can't tell. Now we'll put our contact lens in just like it was before, and I don't take it out for a month. We leave it in there. They're on steroids and antibiotics. And the contact lens stays in for a month or so. It comes out, and I would say this is about 95 to 99% effective. And if it doesn't work, we just repeat that exact same process, focusing on the areas that remain poorly adherent, because usually a majority of the epithelium will be well adherent after one treatment.